Hello everybody, I'm Dr. Carlton Pereira, a practicing ENT specialist, otolaryngologist. Since we encounter a lot of patients both in a private as well as a government setup having a lot of infections. Infections in a busy urban city is one of our most important patients which we have to manage and we have to manage well. Today we are going to talk about Cefpodoxime in the management of respiratory tract infections, which we as ENTs see a lot of, specifically upper respiratory tract infection as well as lower respiratory tract infection. Now, respiratory tract infections are really widespread, not only in ENT fraternity, but also with physicians, general practitioners, and also other specialties. Now, globally, as per 2019 studies, the upper respiratory tract infections reached 17.2 billion. There were 257 million episodes of lower respiratory tract infections, and those are the ones which involve your bronchus, your bronchi, your lower respiratory tract area below the vocal cords. Now, out of which more than 12,000 out of the 1 lakh children suffered from these lower tract infections. These are basically cases of bronchial asthma which get infected and can lead to bronchitis and it can lead to pneumonia, which is one of the most commonest cause of visits to the OPD. Now you can see, as per data, around 4 lakh children below 5 years die every year from acute respiratory infection related disease. We say infection related disease because it can also be over subsided, like there'll be a bacterial infection, but it will also be accompanied by a bad viral infection. And viral infections, as we know from our COVID experience, how lethal it was. So respiratory tract infections often exacerbate pre-existing respiratory conditions, resulting in such a high level of morbidity and mortality, especially in children. Now, so effective therapy is therefore aimed to minimize the frequency of recurrence. As we know, upper respiratory tract infection, especially tonsillitis, pharyngitis, sinusitis, does recur. We want to eradicate the condition from the patient. They should not get a recurrent bout of it. Therefore, we need a good antibiotic. We want to make sure the patient is compliant, because they're compliant to prevent antibiotics resistance from occurring. Now, numerous studies have demonstrated how effective the third generation spectrum of cephalosporins are. Now, keep in mind, we have first generation, second generation, third generation, and fourth generation cephalosporins. Third generation, which we have been using for the last 25 years plus, are widely effective against both the gram-positive as well as gram-negative bacteria. Now, we're here to discuss Cefpodoxime. This is an excellent third-generation cephalosporin and is especially very good for respiratory tract infections. Now, when I'm talking about respiratory tract infections, we are talking about upper respiratory and lower respiratory. We're talking about the tonsils, pharynx, larynx, and we're also talking about the lungs and the bronchi. So this is a very good antibiotic because it's a broad spectrum. It works against gram-positive and gram-negative organism. It has good pharmacokinetic properties, which allows the antibiotic to be given twice a day, thus enhancing patients' compliance. Patients are very happy if they have to take an antibiotic twice a day, rather than if you tell them you have to take one every 8 hourly or 6 hours. Now you compare the earlier generation cephalosporins, and you also compare the antibiotics like amoxicillin, you will see it as a superior base spectrum of activity. Why? Because one of the most important thing, it is highly stable against hydrolysis by the plasmid-mediated beta-lactamases. So therefore, if you go to see, it's a very useful option when we are doing empirical treatment. The empirical treatment covers, now in a case of tonsillitis, we not only give an antibiotic, there will be an antibiotic, analgesic, antihistaminic along with it. So it's a useful option especially when considering empirical treatment. Now, let's look at the various studies which we have. We have the American Thoracic Society and Infectious Disease Society of America. These are the guidelines which we go by in the US. Through the American Thoracic Society, they recommended Cefpodoxime to gain 200 milligrams twice daily. This is used as a combination treatment for outpatients having comorbidities such as chronic diseases, diabetes, alcoholism, malignancy, or asplenia. Now, what we follow here in India is the ICMR guidelines. Now, our ICMR guidelines also recommend the same antibiotic, Cefpodoxime, the third generation cephalosporin, as an alternative treatment in upper respiratory tract infections like bacterial sinusitis and acute otitis media, and also adult community-acquired pneumonia with or without comorbidities such as chronic heart failure, renal lung diseases, diabetes mellitus, malignancies, alcoholism, or patients using immunosuppressive drugs. And the dosage with the ICMR guidelines is similar to the one by the American Thoracic Society, which is 200 milligram tablets twice daily for adults and 5 milligrams per kg twice daily for children. And this is what we use in our practice in Mumbai and India. The same dosage we use, which is a 200 milligram tablet given twice a day for an adult. And we have syrup form, and we also have 100 milligram tablets as well as 50 milligram disposable tablets. So we are pretty much following the same guidelines in India, which the Americans follow and which is practically the norm around the world. Now let's look at some other studies which have emphasized the remarkable efficacy and safety of cefpodoxime. This is also highlighting its valuable therapeutic options in managing a spectrum of respiratory infections. Now, giving 200 milligram dose of cefpodoxime proves to be just as effective as oral penicillin in eradicating group A beta-hemolytic streptococci infection in all age groups. Now, we of course no longer use oral penicillin in India. Oral penicillin was of course first discovered World War II. It was an antibiotic of choice that day. But now with a 200 milligrams of cefpodoxime, which doesn't have any of the side effects as that of oral penicillin and shows such good results, and this is what has been shown in the study in all age groups. Also, chances of successfully eradicating group beta-hemolytic streptococci tonsillopharyngitis with a 5-day regime was similar to a 10-day penicillin treatment. So you can see the difference. Before you would give oral penicillin tablets for 10 days to the patient along with the side effects of penicillin, which was gastritis, loose motions. Here you give cefpodoxime for only 5 days and they will also eradicate that group AB hemolytic streptococci. So you can see how much better it is to give cefpodoxime compared to oral penicillin. Now cefpodoxime, when you put it against phenoxylmethylene penicillin, also gave a better results, or rather an equal result when given 3 to 4 times daily. Phenoxymethyl penicillin was giving, and cefpodoxime was much better by just giving it twice a day. So you can see efficacy of giving twice a day is so much better. Now let's go back to tonsillitis, which is the biggest bulk of this respiratory tract infection. Its eradication rate also is similar to as those seen with penicillin. Now the clinical effectiveness of a 5-day course in sinusitis. Now in ENT, the first patients most common is either they have a tonsillar infection or they have sinusitis. And in sinusitis, the biggest sinus is the maxillary sinus, then you have the ethmoid, then you have the sphenoid. Most of the bacterial infection is maxillary sinusitis. So you can see a 5-day course of cefpodoxime, 200 milligram in adult, twice a day, was the same as an 8-day course of amoxiclav. Now amoxiclav is normally the drug to go to for sinusitis, tonsillitis, because it has also good beta-hemolytic streptococci action. But if you are going to give 8 days of amoxicillin clavinate versus just 5 days of cefpodoxime, wouldn't it be better? Now, a 10-day treatment with cefpodoxime also showed better cure rate for acute sinusitis in adults compared to cefaclor. Cefaclor is another cephalosporin, which is also very effective, but doesn't work against such broad spectrum gram-positive, gram-negative as cefpodoxime does. So you can see a 10-day treatment of it was also better than its same cephalosporin brother. So empirical use of cefpodoxime has therefore led to significant outcomes in cases of maxillary sinusitis in acute phase as well as tonsillar pharyngitis. Now, furthermore, cefpodoxime, as we've just discussed, is also more potent than cefaclor, also more potent than first generation cephalosporins, which is cefixime, and also more potent against 4th generation cephalosporin, which is ceftibutin, against pneumonia. Now, pneumonia is pretty much a deadly disease involving your lungs. Pneumococcal infections are infections which will really be serious to a patient, leading to admission in an ICU and leading to further serious complications. Now, if we can give cefpodoxime at the right time, we can prevent the patient from going to full-blown lung-induced pneumonia. So therefore, you can see cefpodoxime is better than the other cephalosporins, first generation cefaclor, cefixime, second generation, 4th generation ceftibutin, and also strains which display reduced penicillin sensitivity. So a 7 to 14 day course of cefpodoxime within a dose range of 100 to 400 milligrams twice daily is well tolerated. And yes, In Mumbai, we do get Cefpodoxime 200 milligrams sustained release, which you can give once a day for better compliance. So therefore, to end, Cefpodoxime being a third generation cephalosporin is a valuable choice in our battery of antibiotics for treating respiratory tract infection. And why? Because of its broad spectrum activity. And where? Especially against the beta-lactamase. Now, beta-lactamase, you must keep in mind, are the enzymes of the bacteria which try to break the antibiotic boundary wall. And an antibiotic which has good efficacy against beta-lactamase is obviously going to do a very good job. Also, you can see it as favorable dosing, just 200 milligrams twice a day. Also, you can see it's better or it matches the penicillin antibiotic and other antibiotics in various infections. Now, you can also see by the guidelines of ICMR and the American Thoracic Society, it's very well recommended by them as well as our Indian guidelines for treating respiratory tract infections. Also, to end, it exhibits superior efficacy against respiratory pathogens and has excellent tissue penetration compared to the other oral cephalosporins, the first generation, fourth generation. So, to end with, I think Cefpodoxime is a really, really good antibiotic to use for all respiratory tract infections, be it upper respiratory tract infections or lower respiratory tract infections. Thank you.